Okay, I think that we've got a pretty good number. We'll expect that other folks are probably going to join us. For those of you who can, if you put on your camera, that would be great, just to see you for a moment. I know that oftentimes we click off when people are actually presenting, but I would love to see your faces. So I'm Reggie Herder with Policy Research Incorporated, one of the technical assistance agencies with the Safety and Justice Challenge. Tess, I'm going to have you introduce yourself for a moment, and Ashley, and then we'll come back to do some opening comments here. So Tess.
Hi everyone, my name is Tess Edwards and I'm also with Policy Research Associates, and I will be running tech. So if there are any questions or you have any difficulties today, feel free to shoot me a message or to write in the chat. And also a few housekeeping items that you can come off mute during our question and answer portion of today's presentation. So feel free to utilize those functions as well. Thank you, and passing on to Ashley.
Hi folks, Ashley Kreider, Senior Project Associate at PRA. Happy to see you all again. I know you can't see me, I'm at an airport, but tuning in virtually and looking forward to concluding the series, and you're in good hands. So nice to see you again.
Thank you both. We do have folks from 2 different networks on here, and we want to welcome again the Probation Network. So some of you may or may not be aware, especially some of the added folks or added sites to the Impact Network. So through Safety and Justice Challenge, working across 30 plus states, I think it's 32 states, and over 50 counties within those states, has been going on now for about 5 years, learning a little more than that. And as a part of that, through PRI, we created the Impact Network. The Impact Network really being about the focus of mental health and substance use, behavioral health disorders, and the justice system. So that's the Impact Network. And so we have sites that are both from the original Safety and Justice Challenge, and then we added 5 sites to that particular network that were not a part of the Safety and Justice Challenge. As a part of the Safety and Justice Challenge in general, other networks have started to grow. And one of those is around probation. And I'm just, Janine, can I invite you for a moment to just kind of talk about the Probation Network? And really excited to see people on here from the Probation Network.
Yes, hi everyone. Good to see you. Yes, so Urban launched the Safety and Justice Challenge Probation Network under the umbrella of the various networks that have launched in the last year. Ours launched in June of 2022, so just a couple months ago. It's an 18-month engagement, and it's really focused on exploring probation drivers of jail overuse and areas for change, trying to help surface effective practices to address some of those drivers. And so we have a network of about 8 communities, which I think you'll see a slide a little bit later today, but who will be working on that. The network consists of some, it's a learning network that consists of or features light touch technical assistance, as well as quarterly learning sessions and opportunities, again, to address or explore different topics that are tied to probation practices that may be facilitating the overuse of jail.
Thank you very much. I know that you'll talk, you have some slides on that later. Thank you. So let's get into this. Tess, if you will advance to the next slide, please. So for those of you who've been part of the Impact Network, you know we've been working ourselves through the sequential intercept model. For those of you who are not familiar with the sequential intercept model, it's just a way to kind of organize how we think about the intercepts of behavioral health and the justice system. So the criminal legal system tends to process in pretty linear fashion and pretty similar, even though there's different kinds of laws across the states, it's a pretty similar type of flow. And so the intercept model really looks at how does a person with mental health, substance use, disabilities, go through that particular system. So we started this series around Intercept 0 and 1. You might notice that Intercept 0 is crisis lines, crisis care continuum, which is not law enforcement. It is not criminal legal system. However, that is where folks are often getting entangled with the criminal legal system, especially in communities that may not have a robust way to help persons with serious mental illness or substance use disorders who otherwise are going to get involved in the criminal justice system. So we've kind of worked our way through the system, starting at Intercept 0 and 1, 2 and 3, and now we are down at the back end of the system and working on Intercepts 4 and 5. And that is what our two guests will be speaking with you today about. So if you can go to the next slide, Tess. So this is the Intercept 4 is all about reentry, and this is a really significant intercept. So persons at this particular intercept, persons have been detained in jails or prisons. I also personally like to think of this as being coming out of long-term kind of residential or even state hospital stays, because it's all about what's been going on with me up to this point. So what has been have I been getting care? Have I been getting the right level of care? Does it match to my needs? And that would be taking place in Intercept 3, which is really looking again at what do I look like when I'm in a jail setting or I'm in kind of a treatment setting. So Intercept 4 really relies on what took place before it, but it also is really important about, so what is it a cliff effect, kind of a drop off that we're just letting somebody go? Or are we actually being intentional in thinking about what does this person need? And in best case scenarios, the reentry process or that transition process would have started while the person was in that other facility, whether it was a residential facility, a treatment facility, a jail or a prison. But they would have already been thought about what's this person need. It would have started when they first came in, of identifying what those needs are going to be. And then really looking at, so how do we have a very warm, meaning a very direct handoff back into the community again. And as a part of that, wanting to make sure that there's some real clear understandings of what does this person need, who can deliver it to this person, and already having appointments and conversations, introductions to that next level. So this was what's on the slide here is a study that was done in Washington State, 2007. That seems like such a long time ago, but it's a really important study that was conducted where it looked at, so what happened with folks when they were actually released. And you see here this follow-up period of 443 people dying after 1.9 years of release. The primary cause of that is about 71% with overdose deaths. So, and opioids right now, as many of you are aware, and the different places that you are coming from across the country, that opioids, methamphetamine, cocaine, alcohol, all significant substance use disorders, but in particular, opioid-related overdoses is the leading cause of death among people released from jails or prisons in 2019. So it's really very important. And then also suicide risk. And so if we think about the system and thinking about unintended consequences that may take place when a person has been detained and they come out, and especially depending on the length of time that they were detained, if they were maybe a day, maybe that doesn't have the same impact that a person that's coming out of a lengthy jail sentence or pretrial stage, because we know that the majority of the folks actually in most jails are at a pretrial stage, but pretrial doesn't necessarily mean short. And then those who've been incarcerated in the jail setting for many, many years, they're coming out and they really have kind of lost everything and have to really start all over again. So it's very important to take a look at and think about what does it look like for a person re-entering, coming back into the community. If you go to the next slide, Tess. So Intercept 5 then is what's happening when persons are back into the community, and really focuses on that probation parole. So that community supervision is another way that you'll often see it. The chart on the left here is really talking about kind of where do people fall when they're involved in the justice system? About 5.7 million people. Over half of those populations on probation. We often look at probation as being the workhorse. And then another about 1.9 million people, persons being in correctional facilities in the system, and about 820,000 folks that are on parole. So truly probation being a huge part of that. Many states, as many of you might be from, have a combined probation and parole function. But there's still a significant difference in what those responsibilities are and what the actions are that are taken from a probation to a parole stance. On the right is, this is coming out of Prison Policy Initiative. And what it's looking at is the non-criminal or technical violations. And this is something that the probation team is really looking at when we're looking at the overuse of probation, as Janine was just speaking to. So on this, what it's speaking to is the people going from probation to incarceration. There's a large percent, around 42,000 on this, of a new sentence, but that new technical violation far exceeds that, almost doubles that. And then that treatment one, just to point out that really is not necessarily about going back into incarceration, but receiving services, treatment services while incarcerated. And then there's a significant number that was unknown in the study, but similar to that of the findings from parole to incarceration. Again, that revocation, that technical violation as being a huge number. So it's very exciting that through the through the SJC, that there's now a probation network that's taking place. So Tess, if you go to the next slide, I'm going to hand it over to you, and we're going to hear from Javier. Tess?
Thank you. So first, I'd like to introduce Javier Aguirre, Director of Reentry Services for the County of Santa Clara, California. Javier, take it away.
Thank you. Glad to be here. So I'm also part of that probation network, working closely with probation and behavioral health as part of our team with Urban Institute. So great to see you, Janine, and folks here. So again, my name is Javier Aguirre. I'm the Director of Office of Reentry Services for this County of Santa Clara. And our function is to primarily support clients that are exiting prison and jail, and then also providing programming and services inside our two correctional facilities, our main jail, which is literally across the street from our center here, and then our correctional facility a few miles away. So my focus here today is to talk to you a little bit about our Reentry Resource Center and how we collect the data to share with our stakeholders. So next slide. So this is just a picture of outside of our reentry center. So we have two centers. This one is here in San Jose, and it's literally across the street from our main jail, across the street from our San Jose Police Department, which is the largest law enforcement agency in the county, at part of our civic center. And we opened it in February of 2012. So we just celebrated 10 years of the center. And over those 10 years, we added a new center in Gilroy, which is our most southern locality here in Santa Clara County. And over the last 10 years, we served about 20,000 unique individuals in about 100,000 visitors. So over the last 10 years, literally 100,000 visitors multiple times have shown up to access services. So the center is a collaboration between our office, Behavioral Health Services, our social service agency that does the public benefits, our sheriff's office, adult probation, our medical mobile unit, which is part of our ambulatory care, Office of Supportive Housing is housed here. We have the public defender office here with paralegals to provide record clearance. And then we partner with a lot of public CBOs, community-based organizations, to provide services here. And so what type of services we provide, I'll go ahead and give you kind of a feel for the services that we provide. So first, next slide, please. So over about 5 years ago, we kind of did a deep dive in terms of the multiple assessments that an individual may have while they're in custody and when they're released. So we identify someone could go through 14 different assessments, and that could range from 2 pages to like 10 pages to access services. So we were trying to figure out how can we reduce the number of assessments and start sharing information. Well, we realized that we were also part of that problem. Our first intake was 6 pages, and we've now condensed it to 2 pages. And it's offered in English, Vietnamese, and in Spanish. And then we have a release of information to ask the individual that we could share information about their services with all the partners that are here at the Reentry Resource Center. And probably like 98% of all of our clients do sign the release of information. And then those that do not, we really then have my staff sit down with them to kind of convince them the importance of this release of information. So our main focus is serving the immediate needs, whether it's short-term housing, ID voucher, or food in terms of benefits. A lot of people will show up, it's like, okay, so where am I going to be staying for the next few days in terms of housing? And so we link them to either our emergency shelter, or we see they're already in the housing queue to access some services. We have support from our faith-based centers. We have 4 faith-based centers that have sober living environments. So if an individual comes here and we have the staff, many of them can then access a bed in one of those sober living environments, or we do have some motels that we could then house them temporarily until they get hopefully into a treatment. Next slide. So after we try to address their immediate needs, we look at their health services. So an individual can request substance use or mental health services. So they'll get screened and then assessed. And if they're looking for behavioral health, such as outpatient substance use treatment, we have an entire team that does the outpatient treatment here on site. So immediately, once they register, if there's an opening, they could start their treatment the day that they arrive. In most cases, a lot of folks are being referred by court probation or the courts, or mental health court, or substance use, or collaborative courts, and they may be screened in the court, or they need to be screened here. So then they're screened here, and then they send them off to various community-based organizations. So really encouraging folks to access substance use and mental health services. And then we have recovery support. We have peer-led recovery sessions in the evenings, and then recovery coaching both on-site and in the community. Next slide. So one thing that we're very proud of, that when we first envisioned the Reentry Resource Center, we were already thinking about having a clinic on site. And due to all the different licensing, we decided it was much easier to have a mobile van to come on site as part of our system. So we work with our Valley Homeless Care Program, which is under ambulatory care, which is under the big healthcare system for the county. And it's on site, 2 full-time doctors, 2 psychiatrists, psychologists, community workers, nurses, social workers, and just new as a pharmacist. So they're all on site. And this van also goes down to our site in Gilroy on Tuesdays. So we're very proud to make sure that clients have that continuum of health services, because while they're in custody, they may already be getting that health services. So there are some of our community health workers go in custody in the jails and provide a clinic, and to really engage the individuals so they have someone to recognize when they come to the center. And then one of the things that we're also want to make sure is that we do enroll folks in Medi-Cal, either while they're in custody and while they're in here at the center. So that's the continuum of health services. Next slide. So one thing that we're also ensure that our clients have access to is education and employment. And so we have some contract with Goodwill Industries and Catholic Charities to provide employment services. So Goodwill Industries has a program in the jail And so then there's a continuum of services out in the community, subsidized employment and job training. So while they are in job training and in the initial jobs, they get subsidized, they get a wage while they're doing that. And then they are transitioning to temporary or permanent jobs. And then one thing that we realized was the importance of getting a high school diploma and enrolling in community college. So we have a partnership with our County Office of Education. We literally have a teacher on site with a classroom that can provide students the service that they need to complete their high school diploma or their GED. And we recognize the importance of encouraging the individuals while they're in custody to pursue education. So we have, I think, first of in the state, a justice education coordinator, full-time working with clients in custody. So the idea then is to really encourage the individuals to pursue classes while they're in custody, but also in the community. And in order for us to address the generational curse of a lot of our clients' children enter the criminal justice system, is that we're having our education coordinator work with our clients. And if they have kids in schools in the county, then they could also be advocates for them to access additional resources in the community. And then one class that I'm really proud of is that we have an agreement with one of our community colleges to teach a peer mentor class here in the center. So as a matter of fact, they're going to start their fall semester in a few weeks. So clients can enroll in this class. They meet Wednesday nights from 5 to 9 p.m. here at the center, and it's taught by community college instructors for 2 classes. And they get a peer mentor certificate to become peer mentors that can lead for them to become drug and alcohol counselors. So we then encourage them to then apply and go on campus to pursue that curriculum. And we then look at hiring some of those students as interns, and then it is the pipeline for us to hire community workers in the county system. So keep in mind, the county system is about 23,000 employees, and what best way to ensure clients have access to great wages, benefits, both medical benefits and health benefits and retirement, is to get them enrolled higher in our system. And so we did an analysis of about 84 students over the last 4 years, and only one reoffended and got reconvicted of 84. So I think making sure that students pursue higher education is important. And what I do when I go in custody and promote this class, I really, and especially folks that have kids, especially the women and the men that have kids, I was like, what best way to tell your children when you leave jail is that you're a college student. Really changes their perspective in terms of pursuing their reintegration into the community. Next slide. So once we address their immediate needs, their health needs, and their education and employment, we want to make sure that they have support in the community, whether it's case management system like client navigators, whether they work with faith-based centers. So this is the team here depicted on this slide, where they go into the jail and they have a resource table in the evenings and early mornings to inform folks as they're coming out of jail that if they need, a bus token, access to support services out in the community, they have access to one of the faith-based centers. As many of you know, Reentry started with a lot of our faith bases going into the jail and doing a lot of programming. So we now contract with 4 centers out in the community to support us in terms of getting clients engaged. There are many times clients leave the jail, they don't want to do anything with county or government, but they end up in these centers. So then the peers, mentors that work at these centers really encourage them, and they will bring them to the Reentry Center to access more services. And then we have legal assistance. So we have a contract with some nonprofit attorneys to support clients with their legal issues. And then, of course, record expungement. We want to make sure that folks can start addressing and getting their records clear so they're more eligible for employment and housing. So I know there's a question there about the funding. So 10 years ago, the state of California launched what's called Public Safety Realignment, AB 109, and basically shifted all parolees that were coming out of jail that were non-serious, non-violent, non-sexual in terms of their crimes to probation, county probations. And then in lieu of folks leaving from jail to prison, they stayed in the jails. So there was an influx of funding, and every county had their own decision how to support and use that funding. So our county decided to establish the Reentry Resource Center. So we get about 60 million annually in terms of revenue to support the Reentry Resource Centers, community-based organizations, treatment, all of our providers that are here at the center, and then county staff. So we've been able to kind of look at how we invest in taxpayers' funding. And over the last 10 years, it was close to $500 million that we received, and we spent about $480,000 in terms of services to our clients. So next slide. So, you kind of get a sense of all the services that we do and how do we collect the data. And so early on, our chief operating officer was very direct in terms of gathering all of the stakeholders, the sheriff, probation, custody health, behavioral health, social services, and our office, to understand how we could collect data and create a system. So we kind of looked off to see if there was anything that could support the registration information and client information, and we realized that we built it ourselves. So our IT department built what we called our referral tracking system, which is just a database that is housed here at the center. So every client that comes in will fill out a 2-page document. My staff will then enter it into the system, and if they've been here, we'll just refresh the data, and then they sign the release of information that all that information can be shared with all the county partners, but also the CBOs that are contracted with us. So then an email will be sent to our CBOs knowing that they get a referral for one of these clients for these services. And then we have people that have access to it, and there's people that have view access. So the core group that enters data is behavioral health, social services, office supportive housing, and our office. And we kind of looked at, providing a simple way to, and now in addressing COVID, we were able to allow folks submit their applications online, and then they would just populate it into our system. And then as we go back into custody, we could now start registering individuals in the jail, and they're kind of the pre-registered before they end up coming to the Reentry Center. And so what we have been asked by our stakeholders and our elected officials is to use the data to really then share that with the community. And this is our dashboard, years in the working in terms of how do we get all that information into one document to kind of let people know all the great work that, the 90 employees that are here at the Reentry Center and all of our 10 plus community-based organizations that support our clients. So this is just a dashboard from 3 months in terms of the work we do, and we have to present that to our Reentry network, which is made up of elected officials or judges, law enforcement agencies, so they know the magnitude of our services. And then we also highlight the life status, knowing that majority are looking for work, unhoused, and seeking education. And so we always drive to the meeting the needs and highlight the services and the data that we share. So this allows us to then look at the 10 years work that we've done and then pinpoint where we could start making some changes. And then also identify the funding needs of the various programs. So like the medical mobile unit services has been just expanding with adding the mental health side. And then about 4.5 years ago, we added a sobering center at the reentry center. So it's operated by one of our providers. It's up 24/7, and it was geared for law enforcement agencies to drop someone off who was publicly intoxicated. And we renovated our auditorium, put 20 recliners, and it's fully staffed. We're now looking at building a more permanent site here at the center. But now, over the years, the police officers were asking us to provide a location where if someone was exhibiting a mental health crisis or were under an influence of other drugs like meth, and in lieu of jail, they could bring someone here to the recovery, now we call it the recovery station, to access services, and they could stay only up to 23 hours and 59 minutes. So we're now doing a 5-year analysis of that work and how we could then pivot to do some changes, but it's something that we're really proud of. Now our emergency departments, 3 of our hospitals can access the recovery station. Our emergency psychiatric services, EPS, can also bring a client here. And then we have a shuttle that can go to in the field to pick someone up and then bring them here. So with that, the last slide is just a mural that was created by some artists from UCLA and San Jose State University. And this was commissioned by the NCAACP, the San Jose chapter, kind of look at something that when clients come, they have some a vision and an image to see themselves. So this was, all the ideas came from our clients and our staff. And if you are seeking more information about our center, you can visit our website there. And then, or if you're wanting to make a visit to sunny California, we're always welcome visitors. And we had some delegations from China and Russia in the past few years. So always want to make sure we could showcase the work we do here at the Reentry Resource Center. So with that, that ends my presentation. So very thankful to be here.
Javier, thank you so much. So I failed earlier to say why we have these 2 particular presenters, and it really is because it has been a pleasure watching Javier and the thought process, the very careful, very thoughtful process that you and your team have gone through, and really looking at data and letting it tell its story, looking at the needs that are told through that story, and then connecting to services, and that very intentional way that you guys have done this. I mean, from just those slides, Javier, what I always kind of come back from every time I hear you speak is that you're really saying, what's our part in this to make things either better or worse? How do we look at that? How do we simplify and streamline services to make that better for everybody who's delivering services, receiving services? Really an incredible use of community. So whether it's contracted or it's through relationships, bringing in all those different kinds of community resources so that the jail in this case isn't just it's not that thing, it's a part of the flow of the process is what I hear you saying. The mobile van is such a smart way to get things. And then really looking at, I loved it, the intentional work you're doing around family and recognizing that this individual might be with us, but their life and the rest of everything that's going on in their world can be impacted because of what's taking place here. So trying to reduce stigma, trying to make things easy to be able to swallow, to get that support, even though it might be from a position that people may have some angst about it, but also really that connection to family and that real intentional kind of supportive environment that you're creating there. It's just, it's delightful to hear of all the work that you've been doing. I have a question for you, and thanks for asking or answering Patricia's question on funding. Let me back you up, because California is a unique place in how it funds, right? And it has funding that sometimes is also very siloed. In this particular case, you guys chose to use the funding to do a lot of this work. If you didn't have that, so a lot of the places across the country don't have that influx of those kinds of dollars. So what do you think would have been the top things, the top 2 or 3 things that you would have wanted to put in place if you didn't have that huge infusion of dollars?
I think the number one is a one-stop shop, creating that center where you have the key partners coming together, and it's the value of having law enforcement agencies like the sheriff and probation working alongside with your social workers, and your behavioral health staff, just really changes the attitude of it's a partnership, and you could troubleshoot. And so that's the value that I see, having the actual staff here at one stop. And at the beginning, it was kind of a challenge because the community were saying, well, I don't want to go to a place where I know the sheriff will be there. But the sheriff does programming, and they support clients when they come out of jail. And the sheriff has identified the right security folks and the right people to work here, because they also work in the jail. So sometimes they greet people's like, oh, I'm glad you're already out. Okay, what are we going to do differently? And that just sends the right tone. And so I think that's the value of having a one-stop shop. And a lot of counties here in California, what they did is probation sometimes redid some of their lobbies or a center next to them, and they created that hub. In other jurisdictions, it was a community-based organization, but we were fortunate enough to use an abandoned building across the street and just been modernizing it. So I think that's the key, and I think there's ways of doing that with existing funding, and then expanding the services for community-based organizations. Is we do an inventory annually in terms of what can we access, because there's so many CBOs that are doing the work, but it's direct referrals and building those relationships that already happen. So I think that's the value too, is making sure you build those relationships, and then fundraising. We have a 5K run every October, so we're preparing that. So it's a 5K fundraiser where all the proceeds go to purchase new clothing for our clients. So when they come out of jail or when they come here, send new of clothing. So that's something that the community really supports.
Thank you, Javier. I have a couple other questions, but I want to open it up to the group. Does anyone in the meeting have some questions for Javier? You can you can unmute yourself and jump in, or you can send us a note in the chat. So not Janine, go ahead.
I'll ask a question, sure.
Because I was delighted by the data that you presented and the dashboards that you had, and wanted to just ask a question or ask if you could just talk a little bit more about how you were able to really generate that kind of information from across so many partners, and just if you could talk a little bit about your experience with that, because it's great to see.
Oh, absolutely. I think one thing that we realized is start working closely with your legal counsel. So we have, of course, county counsel, which is the umbrella that oversees the government, our county government system, but and letting them know what our need was in terms of capturing the data, and the importance of release of information, that if a client is saying, yes, you could share this information, and it's very simple and direct, that was valuable. And it took us years, and we've modified that release of information. And then we do, and then also gaining the trust of the client, of the benefit. So my staff who are doing the triage and registration are former clients of ours or lived experience. So they really build the trust for the client to allow us to get that information from them, to then use it to benefit them in terms of services. And then, we also have our key partners, whether it's behavioral health or custody health, pretrial, and social services, that they have their own systems. So we're trying to build a system where all the data that we're requesting goes into one centralized location, and we can then pull it. So that's something that we're still working on. But I think one thing that we learned was getting the clients to fill out information that then could be shared with everyone else.
Thank you for that, Javier. One of the things, again, that I continue to hear you say is looking at your clients as resources. So not something you're doing to, but something it's really doing with, and it's really helping them become part of the kind of next solution. So it's a very iterative process in that way. Can you talk a little bit about the dashboard itself? And Tess, if you go back and pull up the dashboard again, and talk a little bit about the platform that you built the dashboard in, because I think a lot of places think of like, oh my gosh, data is so overwhelming, and how can we possibly get this? And who decides what should be shown on a dashboard, and who's the dashboard for? Is it an internal or external dashboard, and access to data and all that kinds of stuff. So I know a little bit about the background of your dashboard, but I want to just ask you to kind of talk about the platform and about how you came to develop this particular kind of dashboard. And I know it's a growing process for you.
Yes, so the platform is basically PowerPoint, and then we store the data in Excel. So my staff has just been able to say, okay, what systems can we use? And so it's been various iteration, and this is something that our elected officials, whether it's our county supervisor, our district attorney, public defender, our judges, really like to kind of see it all in one. And so we do make that public, and we're now working on creating a equity dashboard that shows the racial disparities in our criminal justice system, from just general population, the jail, from probation's perspective, from the DAs in terms of arrests and convictions, and then from our services. So we're gearing up to share that with the public based on this work that we've done. So it's basically gaining the trust of all of our partners that the data here is just what we're getting it from our clients. And then that in turn can then tell us a picture. But now that we're looking at addressing equity, we're now just months away from putting it on our county data portal, which is public, and kind of just showing the data in terms of equity and race and ethnicity. So again, the value of simple software like PowerPoint and Excel can then be used as we move forward with the BI, business intelligence, under Microsoft, with Microsoft.
Thank you. So Power BI, Excel, PowerPoints coming together, making good use of that. All of that cost you $1.50, right? No, really, it's
Exactly.
pretty much free, right?
Whatever the license fees are, yep.
Yeah, it's really, and so again, and you can continue to change it because you have control over it instead of having somebody else have to do a whole new report for you. So
Right.
That's just really smart use. Niles, I see your comment in about loving to have an equity dashboard. I wonder if you had a question for Javier around that, about what they're thinking of.
Yes, I would love to know how he's going to put together the equity dashboard. He kind of talked about it a little bit, but it's something that we're very interested in here in East Baton Rouge Parish, Louisiana.
Oh, absolutely. What I could do is I could, you know what, let me see if I could send the link, or I could send, so we just presented to our Reentry network earlier this month an update on our equity action plan, and we have a prototype of the dashboard. So what I could do is just send it, I think, to Regina, or yep, and then you could see the work in progress. And I now have to meet with the district attorney, the public defender, probation, and our legal counsel to make sure that the data is being pulled from public documents that are already available, but put it in one system. So we're fingers crossed, we're just a few months away from sharing that with the public.
Javier, that would be great. And we will attach. So the slide decks we will share, we'll post this to everybody who's here. And so we'll add that, what Javier sends us, we'll add that to that posting so that people can access it. So thank you, Javier, for willing to share that.
Absolutely.
again, thanks for anchoring also to start early and ongoing with attorneys and make your life much easier,
Right.
to have them not say no, but to be partners in thinking through the how to do this
Exactly.
work.
Yep. Absolutely. Yep.
And understand your framework of doing so. And especially as you're looking at that transparency. So thank you for that. Any other questions from anybody around Javier and his team's work? Seeing none right now, I'm hoping that those of you who, and I saw Suzanne, Suzanne's from Charleston. So Suzanne's a data wonk there. I mean that in the best of ways. So I know that you were kind of geeking out there a little bit, Suzanne. So I wonder if you had any question for Javier, or just also want to just acknowledge that your comment about loving this, right? That it's just such a great way to tell the story about what's taking place within your system, and really looking at, what we measure is what matters. And what you're really doing is looking at what really matters to you as a county, and showing that very specifically through this. And really, I think then using it to inform both officials, but also the public about what's actually taking place. So love that. Suzanne, did you want to make a comment?
Yeah, I was just going to say, you caught me. I have been snipping and copying and sending emails to my team about what this cool dashboard is that I'm looking at. And we need to do this, and we need to, because with our MVP program, we're keeping a lot of that information, but we don't know how to present it just like this. And you made it sound so easy. So you're right.
And
You got to measure what matters.
right. And if any of your staff want to connect with my staff to help, let them, walk them through the process, we could definitely do that too.
Will you be in Atlanta?
No,
Next
we're sending probation and behavioral health. So because we only send 2 people. So yeah.
Gotcha. Okay.
But maybe the next one, I'll be there at the next convening. Yeah.
Well, thank you, Javier. I'll probably will be reaching out in a little bit.
Yep, absolutely.
Thanks.
Thank you both for that. Thanks, Suzanne. And again, Javier, thank you. So I don't see any other questions. We'll have time again at the end for questions from both Janine and Javier. But Javier, again, thank you so much. Because what you guys have done again is that really thoughtful process of thinking about those transitions and thinking about what do you do in this space, whether it's a reentry space or jail programming, what do you do? And how does that then connect to either people not being under services at all in the community, or actually being in services. And so Janine's going to talk a little bit about kind of the jail to transition network and that, or jail, I can never say it, and Janine and I is part of the first group with it, right? Transition jail to community, there we go. I knew I had it in me still. So in Denver, my former life was able to work with Janine in that kind of first iteration, and I know it has really advanced over the years since then. And what Janine also really brought to that particular work was the evaluation process and understanding, and then also looking at taking it from there into the probation. And I know that so much what Javier just talked about is at the heart of the value and the meaning around that transition jail to community. So Janine, we're going to let you take it from here.
That sounds great. Thanks. And lots to build on. It was great to hear about Javier and the work that Santa Clara is doing. And that's kind of one approach to reentry, and a great one. And as Reggie said, I'll talk a little bit and share with you about the transition from jail to communities model, which was really meant to be an evidence-informed, useful framework for a comprehensive reentry strategy for jails. So can we go ahead and advance the next slide? Great. So I just thought I'd tell you a little bit about the Transition from Jail to Communities initiative, give you the context, tell you a little bit about the model, our sites, some of the lessons learned from implementation of this model that I think can be applicable for you all as well, and share a little bit about some of the resources. And this was a model that was really designed to address jail reentry broadly, but a number of our sites did choose to focus on people who are in the jail that have behavioral health needs. And I'll highlight 3 of those sites, including Denver. So Reggie, I'll count on you to jump in if I get anything wrong that you might remember from that. And then we'll end with just a little bit more information about the probation network too. So I think if we go ahead and just advance to the next slide, please, thanks. And Reggie really covered this at the beginning, but again, just thinking, I like to think about the opportunities here to assist people with behavioral health needs at intercepts 4 and 5. So thinking about reentry, and as Reggie highlighted a little bit earlier, the emphasis here really on continuity of care. And I'm talking specifically about continuity of care and meeting people's needs from a period of incarceration, whether that's pretrial or a period of sentenced incarceration in the jail, you know, and as they're moving into the community. So really thinking about how community and jail facilities are working together in order to address those needs, thinking about transition planning, doing the kind of assessment that's needed to identify individuals' needs and to plan for that, both hopefully to provide services while they may be in the facility, to hopefully take advantage of that time when they're there to provide services and address gaps that they might have, but also prepare them for transition to the community and stability there by connecting them to services, and ideally through InReach, not only from behavioral health, but other providers, to really build a bridge that helps with that transition into the community. And then thinking about the opportunities in Intercept 5 with community corrections. And again, you know, where there's opportunities to address what might be perceived as problematic behaviors that could, you know, through traditional means, either usher people back into the system or deeper into the system. So thinking about how where there's opportunity to use some alternatives to address some of those behaviors and address the needs that people might have, so that they aren't ushered back into the system or deeper into the system. So I think if we go to the next slide, I'll tell you a little bit about the Transition from Jail to Communities initiative and the model. So this goes back 15 years, which is hard to believe. It was an initiative that was launched, as you can see, in 2007. I keep wanting to say 2017. I think that's wishful thinking. It was really a partnership between the National Institute of Corrections and the Urban Institute. And the idea was to design a model that would assist local jurisdictions with facilitating successful reintegration from jail to the community by addressing some of the unique opportunities and challenges of jail reentry. And what was unique about this was really, if anyone kind of can think back and remember, in 2007, I should say, you know, the conversation at that point had really been all about prison reentry. And yet we knew that millions of people were cycling through the nation's jails, you know, annually, and that short stays, even very short stays, can be incredibly disruptive and destabilizing. And so thinking about needing a framework that could draw from the best evidence that we had at the time to apply those evidence-based practices in a comprehensive framework that would address, like I said, the unique opportunities and challenges of jail reentry. And so the national TJC team included the Urban Institute in collaboration with the National Institute of Corrections, as well as John Jay College of Criminal Justice, Corrections Partners, Inc., and Alternative Solutions Associates. And we worked together to design this model. And the model was really meant to be, or to facilitate long-term systems change and to emphasize that collaborative community-based approach that we heard Javier talk about and what you were seeing there in Santa Clara. And we did that. So it was really focused on jail community partnerships. It was meant to apply broadly across, or really to anybody who might be incarcerated for, you know, any period of time. So pretrial as well as sentence populations. It really drew on a triage approach, the idea of universal screening, targeted assessment, and linking to evidence-based practices. We had, it was conducted in 2 phases across 14 sites. Phase 1 was, those initial sites were really helping us test the TJC model. Was it viable? Could it be applied in a variety of settings? Did it work? What were the challenges there? And then we took those learnings or those lessons refined the model a little bit, and then worked with additional 8 sites, including several California sites, to apply the model, and expanded the focus or made it more explicit to really include the pretrial population as well as people who were sentenced there. We did do a process and systems change evaluation across those sites just to look and see if the model was viable. Did it change the way communities were doing business around jail reentry in terms of policies and practices, and how so? And then we also generated a number of tools for the field, and you can see that here. We have an online learning toolkit that's still available through the National Institute of Corrections website that walks you through all the components of the model, which I'll show you in just a minute. We also have case studies that profile the second round of sites, our phase 2 sites, and provides information about how they applied the model, and then evaluation reports as well as topical briefs. So we have some briefs, for example, on case management. What does that look like for a jail reentry population, as well as screening and assessment? So you can still find all of those tools if you'd like to on the National Institute of Corrections website under TJC. So just a little bit about the model itself. I'm sure you're wondering, what does this model look like? And if we advance to the next slide, you'll be able to see. So this is the TJC model. Again, it was an integrated approach that was meant to span organizational boundaries. So to deliver the needed information and services that people required. It included case management. It was focused on having collaborative partners that really shared the responsibility of jail reentry. Again, this was not just the jail's responsibility, but it was really meant to be an approach that recognized that there's a shared ownership here between the jail and the community to be able to assist people as they're transitioning from the jail into the community. What you can see here is that the model included both system level elements, which were critical to its implementation and sustainability, as well as those individual level elements, which really focused on the work that was done with individuals who were in the facility. So looking across the top there, we had leadership, vision, and organizational culture, the idea that effective jail transition strategies require the active involvement of key leaders and decision makers, and really people who can help with the political will to change the way business is being done in the jail and across partners, and to engage key staff and generate some buy-in. There's also a collaborative structure, and again, this idea of joint ownership. Key to this was having an implementation body as well as a policy body in each of the sites that would bring key partners together, that would be able to really reflect on the strategy so far and make changes and do some joint planning and decision making. A data-driven approach was key to this. So again, thinking about the data that Javier was able to provide and how that county is using that data on a regular basis to look at issues and to measure progress was key here. And then the intervention strategies, which you can see again, went down to really those basic building blocks for effective jail transition and providing individual services to people who are in the jail, and thinking about what those services were. And that included things like screening and assessment in order to understand what people's needs were, then developing applying that to a transition plan, linking them to evidence-based interventions, both in the jail and in the community, and providing that support post-release. And then another key part of the model was self-evaluation and sustainability. And again, this idea of making sure that we're helping communities to collect key information. We developed a set of core performance measures that each community collected and reported on a quarterly basis in order to see if they were using these practices that they intended to put in place, and if we could see if things were moving in the right direction. So trying to both use it to monitor progress and also identify some potential positive outcomes, as well as areas of challenge that might need to be addressed. If you advance to the next slide, this just illustrates the triage approach that I mentioned a little bit earlier, the idea that everybody would get something but not the same thing, right? And that you're triaging people who are in the facility by risk, need, and length of stay. So that was accomplished through a universal risk screener for risk to reoffend, usually a booking and classification, depending on, for those who are screened as medium and high risk, they would get targeted risk needs assessment to be able to identify those criminal genetic factors and needs that they might have. And then that would move into case planning and connection to interventions that was dependent on their length of stay and what could be accomplished while they were in the facility and what needed to happen while they were in the community. And again, the use of evidence-based practices, so programming that had some kind of research base behind it that suggested it was effective as opposed to homegrown programs. If we advance to the next slide, please. Just to share, you can see what our TJC learning sites were. This was our complete network of 14 sites. It's things to highlight here is it really was a range of communities, geographic communities, and jail sizes. We wanted that geographic diversity as well as differences in jail sizes to really test the model. So we had small, jails that had populations of less than 200 people to one of the largest jail systems in the country, Orange County, which had many thousands of people who were in their jail. And each of these applied the model. And if you can see, it might be a little bit hard, but several of our sites are bolded there to indicate that they had meaningful connections with probation. Probation was brought in as part of the collaboration and as part of the partnership and worked in tandem together. So I think we have 5 sites that are bolded there. Denver was one of them, Kent County, Michigan, Howard County, Maryland, Fresno County, California, and then the 2, and then San Diego and Santa Barbara as well. So that's our network. And if we move to the next slide, just to share a little bit about, as I said, each of the communities that we worked with applied the TJC model, and they did so in different ways. At least wanted to highlight 3 here that had really emphasized or chose to focus on people with behavioral health needs. And as you can see here, they did so in different ways. So I wanted to highlight here Franklin County, Massachusetts, which was one of our smallest jails. It's in a rural south northwestern Massachusetts. They chose to use the TJC framework to help implement a step-down model that with different treatment options based on security levels. So for example, their pretrial, people who are in pretrial would be connected to clinical groups and participate in other services, both in the jail and then in the community. And they had a facility there, the Kimball House, that acted as kind of a halfway house for people to transition to and be connected to services. So along with job opportunities, so they're receiving services in the community as well as with employment readiness and then employment positions. For people who were sentenced and of medium security, they received intensive trauma-informed treatment along with a focus on behavioral, cognitive behavioral interventions and then vocational training and job readiness. And they really focused on folks who were about 60 to 90 days out in order to, provide that preparation and allow folks to go through some of this CBT training and programming in particular. And then they also established a unit or a specific pod for folks that was heavily focused on cognitive behavioral interventions, including and mindfulness and case management. And again, the idea to really help folks prepare for release. And then they connected them to the Winslow House, which was a transitional housing facility that was established really through a partnership between the Sheriff's Office and the local housing authority that provided support for several months in the community after release, again, with the idea of really trying to help people be successful and stabilize after a period of incarceration. In Kent County, Michigan, which was one of our phase 1 sites, folks there established 2 dedicated pods for people who are in the jail. One was their valued community member unit for people who were duly diagnosed. And again, this featured a really robust partnership with a community-based provider that focused solely on mental health and one that focused solely on substance abuse treatment. And staff from those organizations were brought into the jail, were housed in the jail in terms of having offices there, and worked, within the unit to provide assessment, to provide treatment, and then transition planning. And then folks would continue with those 2 agencies once they were released into the community. And their probation played a critical role in that they were involved in those treatment teams and exchanging information so that probation could benefit from the assessment information that had been collected and treatment information to help, apply kind of appropriate stipulations in their community supervision as the person transitioned into the community. And then in Denver, Denver did quite a number of things. They developed 2 substance abuse treatment focused units, RISE, one for women, one for men in the facility. They also implemented a life skills program for people just in general who are transitioning, which addressed a number of just life skills and including cognitive behavioral programming, as well as connecting them to 2 programs in the community. One was the frequent user system engagement, the FUSE program for people who were returning frequently to the jail. And the other was the community reentry project, which aided transition and reentry by connecting people from the life skills program to case management and services in the community that would aid their transition. So again, all of these highlight, I think, really the key role of partnerships with community-based organizations, the importance of inReach and collaboration here. And if we go to the next slide, I can share with you just a little bit about what we learned and the site's accomplishments from the TJC model. So as I mentioned, this was a model that was meant to be flexible, could be applied really in any jail setting or system. And we wanted to test that out. And we did learn or see that across our 14 sites, each made considerable progress in implementing this model and using it. And many of them are still using facets of it today. But some of the accomplishments here was that the model really helped sites build functional collaborative, both governing and implementation bodies, many that continued after TJC, and the idea that they really brought together the community-based organizations and system actors, particularly the jail and the sheriff in this process, in this planning process and decision-making process. Most sites implemented a number of evidence-based practices that had not been in place before, including universal screening for risk to reoffend, targeted assessment, discharge planning, as well as expanded the continuum of evidence-based programming that they had available in the jail. Many focused on expanding their use of cognitive behavioral therapies, the substance abuse treatments as well, and inReach. And then many of our sites formed really robust partnerships, again, with the idea of really jointly owning this issue of jail reentry. And last, I'd say many produced the quarterly performance measures, and some sites even use them, but this was probably one where it was most challenging. And it was great to hear Javier talk about, in my words, kind of starting small and moving forward, right? Making those strides to collect something with the tools that you have, and then think about how you use that. And so a number of our sites did that, and we really encouraged folks to start small where they were and try and build that capacity so that you're collecting some information and able to share that across your partners. And I think we have one more slide on TJC. Yep, and just lessons learned around this. And the importance here, I think I would just emphasize of really, the idea of what we learned was that a model like TJC for comprehensive jails transition really can be implemented across a wide variety of settings and contexts. You can start with relatively little infrastructure, or you can start with a lot. And I think the idea here is that where you start from and your priorities will differ, obviously, by the amount of infrastructure you had. But our sites really did differ quite a bit that way, but all of them found ways to implement these elements and to build on them, even those that had very little. And I think the other big takeaway that we learned was fostering this kind of systems change really takes time, and it takes intensive collaboration. And some of that is, really focused on the idea of coming together, developing a shared understanding of each other's policies and practices, what's possible, what's not, learning to speak a similar language and not underestimating the barrier that can be, as even we learn agencies that work within the criminal legal system broadly, right? Elements and components of that speak different languages, probation from the courts, for example. But that's necessarily, but not sufficient. And it really meaningful change has to go beyond that to really reflect changes in policy and practice. We also learned the importance of engaging and training line staff on reentry strategies and practices. That's one thing that Kent County did. They trained the COs, the correctional officers who are working in those two designated pods on the cognitive behavioral therapies that they were using, which made, they thought, a big difference in reinforcing the learnings of those programs and helping people to apply those. Also, the importance of just engaging executive leadership broadly, not just the top leaders, but really thinking about who your key leaders are across these agencies and how to engage them in decision making. And then moving from a commitment to vision to really implementing, measuring, and monitoring your progress. It's great to have a commitment to vision, but then you really have to move on that through trial and error. And then a number of just lessons learned around sustaining systems change too, that we emphasized from the beginning, really building in and thinking about sustainability from the very beginning as you're starting to change processes, and doing that in a number of ways, from documenting those processes and having good procedures in place that can weather transitions with staff and leadership, and really encouraging that strategic development and cultivating relationships from the very beginning, thinking about who's responsible for cultivating and tending to these different relationships, and thinking about the resources that are there beyond just funding to be able to really leverage as you go forward to sustain the gains that you've made. And so I think that's it on the TJC model. And there we go. Thanks.
Janine, thank you so much. If I can take a moment, one of the things I remember back in starting doing the work of TJC, and one of the things that provided us was a framework and that common language for all those different levels of folks to come together, and also really, I think, bringing together some values about the importance of the work. It was also, and I think, Javier, of the work that you guys are doing is kind of coming from a single source agency and being able to derive some of that, where I think, I'm wondering, Janine, in a lot of the sites, and I think it was true in Denver, where there was jail programming going on, and the culture of the jail programming may not have been as intentional as what it could have been or ended up as we moved through the TJC model, because it was like, I remember we had people that were being trained to be flaggers, right? Like on construction sites, there was a whole thing on that, but it was during the time when there were no flagging jobs. And so it was kind of one of those things of really looking at data and really having some of those conversations to pull people together to say, lovely, but that's just not where that's not going to really matter for the person. So that stability is not going to have an impact. It might be great for your program, but it's not necessarily great for what we're trying to achieve. So I'm just wondering if that was some common stuff across the different sites that you encountered.
We did hear that, and we checked in with sites too after their implementation experiences to see if some of these collaborations had continued. And I raised the issue of collaboration because I think that what TJC did was provide, as you said, that framework and structure, and particularly around those two kind of what we call governing bodies, right? It was the idea of bringing disparate partners together as partners to be able to really talk about the jail strategy broadly, what was needed and what wasn't, and what the data showed, right? And I think it was an opportunity for people to learn from one another, but also to really kind of interrogate what they were doing, what was in place, how we could connect it. Did some of these things make sense? Where could we make changes? And through the individual expertise and knowledge of those different partners to really form something that might be perhaps more responsive, right, to the needs of people based on the data that was being collected.
Thank you for that, Janine. And Niles, I'm going to come to you because there's space issues also. So there's pod issues, there's populations in the pods, there's how the facilities are set up. Are they having to move people to a place that has programming, or they're doing programming in the pods themselves? So there's a lot of design structures and security kinds of conversations that took place, as I remember things, but that data part was really key. And Niles, let me have you ask your question, because we found out that there were populations we couldn't serve well because they were flipping through so quickly. So that had to be different strategies. But Niles, go ahead and talk more about what you're thinking.
Yeah, and that was my question for short-term individuals who kind of come in and out of the jail system. How can they benefit from this program if they're not there long enough to be able to have the intervention that they need?
Mhm. Yeah, that's a great question. And particularly as we expanded to the pretrial population in the second phase and really thinking about how to effectively engage and meet the needs of those folks. That was a real challenge, right? And so again, with the idea that this being a strategy, not necessarily a program, and thinking about that triage piece, communities work to really identify first through the data, how long people were there on average, to think about what the opportunity was to connect with folks. And then, as you're saying, if people are cycling very quickly, thinking about, can we connect them to resources in a really tangible way? They may not receive them in the facility, but they would receive them or have a greater chance of receiving them in the community through these partnerships. So, some communities put different, strategies in place around that, having caseworkers embedded from community organizations that could meet quickly with people who might be there, pre-trial in very short periods of time, but had enough time because of the universal screening and hopefully assessment if they needed that to identify that they might have needs. I mean, the other is for people who are assessed as really low risk, who would be moving through quickly, it might be something like having a resource, not a guide, but some resources to connect them to, like literally handing them information to be able to do that. So just depending on both the level of need and the length of stay. Does that make sense? Yeah.
So I'm wondering, Javier, if you have some thoughts about that also, what you guys done.
Yeah, so I've tried to figure out, like, looking at a quadrant, like based on the client's needs. So we were looking at folks that have high needs in terms of housing, employment needs, and then those that have high need for substance use or mental health services. And so what we're trying to do is those that have the high needs for substance use and mental health, they're usually in our court system or they're part of our collaborative courts. They're going to be assessed and triaged. And our hope is that a treatment provider will be picking that individual up and taking them to their treatment, even if it's a short stay or they've been there for a long stay. It's the ones that we have, like the sign and release within like 3 days. They come into the jail and they're out the door. And usually it's a brochure on their way out, or they just want to leave and not come back. But we're trying to figure out and tracking those that have been in and out of the system frequently. And if they stay a little longer, pre-trial is doing a lot of assessments upfront. And so they can start connecting them with services. And then our custody health, which is a county department, is now doing upfront assessments when the clients are being booked. It's getting them engaged and let them know about the services, but it's a hit and miss in terms of the short time, the people that are there for a short period of time in our jail system.
Thanks for that, Javier. Again, one of the great things that I found in doing the TJC process was it really allowed us to understand more about who was in jail, why they were in jail, and it led to a lot of other kind of things, right? Other conversations like how do we define pretrial? Because what we found was that how pretrial is defined by the sheriff's department versus the pretrial folks, right, that did pretrial services versus the courts versus probation when they would do a pre-sentence investigation type of report, all that was different. And so it really, the model, because of kind of how it was set up and gave us this framework, really pushed us to have those conversations about who are we serving and why, And how do we serve populations that are different? So our cutoff was 45 days because they had earned time and good time. And so 45 days would give us 30 days of programming on average. So if we knew they were going to be then we could identify that population. And we used the sheriff's department put in other measures for data to help identify folks. And then having that universal screening was really key, so that even if people were going to come out really rapidly, we still had a little bit of a sense. They didn't get a full screen, but we did kind of more of a short type of screen. And that gave us at least a little bit of a sense about what people need. So then we could start thinking about, so for that quick transition, for those folks that were going to be there less than, just hours, right? Versus less than 45 days, what could we do? I remember conversations about the trustees. So there was, the jail was run by trustees, and the trustees were in separate units. And so really kind of thinking about, so could we do something different with trustees, because they had work stuff. So they otherwise couldn't do programming, because they couldn't do some programming because of how the jail environment was set up with managing the jail. And so trying to think differently about how do we get services to that population. But that was all because of trying to understand two things. One was data, and the other was the conversations and the trust that started being built with the sheriff's department around service delivery, around programming and service delivery, which was really key. And I'm wondering again, Janine, in the model, did other places, when you think about that length of stay, also really think about those populations?
Sure. And how to reach some different groups, right? The opportunity that you had and what you didn't have. So definitely, I remember, I think Hennepin County in particular really thought about that and thinking about what you could offer and what you could do. And I think it, more broadly though, by bringing partners together and kind of, again, interrogating this and thinking about what the options were already, where you need to build out, it led to questioning, like, why are we doing this? Who are we missing? And what are we inadvertently precluding people from, maybe in terms of those approaches and thinking about how to make those changes. So it was key for sure in some places, thinking more about that.
Absolutely. Go ahead, Janine.
I was just going to say, and also thinking about, how you could, or if you could dovetail some of these services too. I think sometimes they were so discrete and kind of isolated that people were thinking, well, you're in this particular program or this, pod, so you were kind of excluded from the other. And I think it provided the sense of a more comprehensive way to think about what could happen and approaches and just trying to expand access, right, for people who might need multiple things and not necessarily thinking about how the sequencing of that.
Yeah, one of the ways I remember that coming out was the CBT. So we did Thinking for Change, and we did that because it's shorter than some of the other CBTs classes, but we could also pick it up wherever they were, right? We continue those classes in the community with the same provider, and they could pick it up, those modules up, instead of starting all over if you did a different kind of a CBT type of class.
Right. So you weren't precluding people. And in fact, you were trying to, you were providing more options for exposure to that and to continue. And I think that was even a change, for some places to really be thinking about how to do that. Yeah.
It's huge, huge.
Yeah.
Are there other questions that folks have? And I'm wondering, Janine, if you want to talk a little bit about the probation network and how the probation network is also thinking about that reentry. So folks who are coming out are often going to be connected then to probation services, or the other part is those technical violations. And if you want to speak a little bit about how you guys are thinking about technical violations, and again, around reentry, because to me, there's such a natural fit, right? Of saying, if there's a technical violation, what are we missing? And how do we help support this person?
I think that's right. So I think, again, early in our network, a lot of it has conversation so far has really been thinking about identifying some of those drivers again around jail use by probation, a lot of it focused on those technical violations and potentially revocation, thinking about why that is, I guess, to your point about kind of what we're missing if people are cycling back through because of a revocation potentially. So really trying to just explore that more, take a look at some of the data that communities do have to understand the issues there, and think about where there's opportunities to build that out and change, address that through other interventions or alternatives. I do agree that there is an opportunity here around reentry to think, and if you're thinking of reentry more broadly, right, not just that someone has been sentenced to a time in jail, but just thinking about through that cycle, like what are we missing? How can we better maybe assess and use that information, share information, and use some alternatives that would, rather than revoking or sending somebody back, might preclude that and put them on a different track. So we're really at a starting point, I think, to ask more about that and think about also for people who are, who are revoked, thinking about lengths of stay or things that have led to that in terms of a warrant being picked up and, what needs to happen there to stem that in the future.
Thank you. I'm going to start wrapping us up here. So I'm wondering, Javier, you first, any final thoughts for this group?
No, I'm available if people want to connect with me, getting some information. I'll definitely share some documents. I was just also thinking of sharing our registration form on our release of information, because sometimes you want to look at best practices in terms of, or how to have some samples. So I'll definitely do that. But I look forward to supporting any efforts in other jurisdictions, because we're all trying to help our clients and cross boundaries. So thank you, appreciate it.
Thank you so much, Javier. Janine, any final thoughts from you?
No, I really appreciate the opportunity to be here and say, do you look at the resources that we have around the TJC framework? And we're really excited about the probation network and building that out. So I imagine you'll be hearing more from us. And so glad that so many sites could be here today.
Yes, we really appreciate that. Thank you, Janine. We have a couple final slides here. So Tess, if you'll go forward. So as we wrap up today, and again, we hope to see many of you down in Atlanta. I know some of you will be joining us and others will not be. But for those of you we look forward to having that conversation. So if you'll go back up to Tess, thank you. One more. So there are some, when we send out the information, again, we'll send what Javier is going to be forwarding to us. These are the TJC toolkit that Janine was talking about before. Pew has recently put out some policy reforms and really around that revocation technical violations, and then also the pathways to success on probation, which also really brings in some of the work around behavioral health and probation. So that you go to the next slide. So those will all be attached to the to this recording. And again, this really concludes our part for the Impact Network for this particular year, at least, and looking at all the different intercepts. So there's videos or meetings that have been that we have videoed and kept from all the different intercepts. And I would just make those available also to our Probation Network friends if you want to look at anything that needs to be here. Thank you, Janine, so much. Thank you. So if anybody wants to see any of the other meetings that we've conducted where we've highlighted different places across the country from the other intercepts, just let us know that. And then if you go to the last slide, again, we look forward to seeing folks who are able to travel to Atlanta at the Impact Network meeting that we'll have the day before the full convening in Atlanta. And then others of you will be coming in or may not be coming in as part of the Probation Network in particular. So I know Javier will get to see you there. We appreciate that. We so appreciate all of you guys for tuning in today and for being a part of this. Special thanks to Javier and Janine for sharing their wisdom. And with that, we'll wrap it up. Tess, thank you so much as always for keeping everything on track. We really appreciate it. Everybody go forward and do great work. Thank you.